Welcome back to Learn with MedNuggets. In this video, we will talk about cystic fibrosis. Cystic fibrosis is an autosomal recessive disease caused by a mutation in the CFTR gene on chromosome number 7. It's caused by a delta F508 mutation where delta refers to the deletion of the 508th amino acid that makes up the CFTR protein. This will cause the CFTR protein to malfunction or not be made at all. So what is this CFTR protein? Where is it located and why is it important to have a normal CFTR protein in our body? Let's find out. Any part of the body that contains mucous membranes like your respiratory tract and GI tract have CFTR proteins in them. For example, if we take our GI tract, it's lined by a layer of epithelial cells. The apical side of these epithelial cells that makes contact with the mucus contains ion channels made up of CFTR proteins. These CFTR ion channels pump chloride ions into secretions. Once the chloride ions are in the secretions, they attract a layer of water to thin out the secretions and maintain the right amount of water and mucus in it. So now let's go back to cystic fibrosis where the CFTR protein is absent or is not functioning properly. In this case, your secretions will not contain chloride or water, and this will lead to abnormally thick mucus in your GI tract and respiratory tract. Abnormally thick mucus in the lungs will lead to recurrent lung infections, especially with the organisms Pseudomonas aeruginosa and Staphylococcus aureus, which you must remember for your board exams. It will also lead to obstructive lung diseases such as chronic bronchitis and bronchiectasis in these patients. Thick mucus in the GI tract can cause a condition called meconium ileus, which can be the first presentation of cystic fibrosis in babies. Meconium is the first stool that a baby passes as soon as it's born, and this usually happens within 48 hours after birth. Failure to pass meconium within the first 48 hours after birth is called meconium ileus, and this can happen due to the abnormally thick stools in cystic fibrosis. Thick mucus in the pancreatic duct and bile ducts can lead to impaired flow of these secretions to the intestine, which can lead to fat malabsorption, because you need bile acids and pancreatic enzymes to digest fats. No fats means no fat-soluble vitamins, as fat is required for the absorption of vitamins A, D, E, and K. Deficiency in vitamin A can cause coagulopathy. Deficiency in vitamin D can cause rickets. Deficiency in vitamin A can cause night blindness. And deficiency in vitamin E can cause ataxia. These nutritional deficiencies can lead to failure to thrive in infants. As fat is not absorbed, it will be passed in stool. Stool containing very high levels of fats in it is called steatorrhea. These stools are usually bulky, greasy, floating, and foul-smelling. Now I know stools are of course foul-smelling. But remember that in your exams, if they give this type of a description, they are referring to steatorrhea, which could be due to a problem in your pancreas, bile ducts, or your intestines. Also, thick secretions in the pancreatic duct can cause chronic pancreatitis and diabetes. When pancreatic secretions containing pancreatic enzymes clog the pancreatic duct, these enzymes can get activated and digest the cells lining the duct. This can result in inflammation of the pancreatic tissue. Repeated episodes can trigger a chronic inflammation and lead to chronic pancreatitis in these patients. Chronic pancreatitis can eventually lead to the development of diabetes, as the burnt-out pancreas will no longer be able to make insulin in these patients. This is called cystic fibrosis-related diabetes. The thickening of secretions in the biliary tract can lead to obstruction in the bile duct and backup of fluid to the liver. This can cause enlargement of the liver and ultimately lead to cirrhosis. The obstruction of bile also disrupts the balance between bile salts and cholesterol in bile and produce gallstones. Cystic fibrosis can also lead to a very important complication, that is infertility in males. It's extremely important to keep in your mind that this is not due to the thickening of semen and obstruction to semen outflow. Instead, this occurs due to the failure of development of the vas deferens. So these patients will need to use assisted reproductive technology in order to have kids. Cystic fibrosis can also reduce fertility in females due to the abnormally thick cervical mucus affecting the movement of sperm to the fallopian tube. Cystic fibrosis can also cause digital clubbing and nasal polyps, two very important clinical features that you must remember for your board exams. Allergic bronchopulmonary aspergillosis is another condition that can happen in these patients due to the growth of Aspergillus fumigatus in lung cavities or sinuses. So now let's talk about the diagnosis of cystic fibrosis. Cystic fibrosis can be diagnosed via newborn screening. You can do a sweat chloride test to confirm the diagnosis. High levels of chloride in sweat will confirm your diagnosis. This is because the CFTR proteins lining your sweat glands absorb chloride from sweat rather than pumping out chloride into secretions like in your GI tract and respiratory tract. Therefore, absent or defective CFTR proteins in the sweat glands will lead to the accumulation of chloride in sweat. You can also test for the blood immunoreactive trypsinogen level in these patients. Cystic fibrosis patients will have an elevated level of this enzyme due to the damaged pancreas leaking its enzymes into the bloodstream. Cystic fibrosis can be treated with drugs such as N-acetylcysteine, Donase alpha, and chest physiotherapy to thin the mucus and clear it up from the airways. Exacerbation of cystic fibrosis by microorganisms like Pseudomonas and Staph aureus can be treated with antibiotics. CFTR modulators like ivacaftor and lumacaftor can be used to restore the flow of chloride ions via CFTR proteins. Lung transplantation also has a place in the management of severe cases of cystic fibrosis. We can also replace pancreatic enzymes and vitamins in malnourished patients and also vaccinate to prevent infections. That brings us to the end of our video. Thank you for listening. Have a nice day.